Good morning, everybody. My name is Dr. Raj Gupta. This is my second video for a public education regarding regional medical center closure of specialty services of trauma, comprehensive stroke, STEMI programs. Just a few things about myself. I was the president of medical staff at regional during this pandemic time. I was also board of trustees at RMC for 4 years. And I'm a neurologist at regional Good Samaritan Hospital and O'Connor hospitals. Some definitions, HCA stands for Hospital Corporation of America, for-profit hospital chain, has about 175 hospitals throughout the United States. Net income for 2023 was $5.2 billion. RMC is a east side of the San Jose, 264 bed capacity, and it's a HCA hospital. GSH stands for Good Samaritan Hospital, west side of the San Jose. Again, these RMC and GSH, they are sister facilities, belong to the same parent, which is HCA. RMC announced their intent to close these services on February 13. The EMS had a public hearing on March 27, and the County of Santa Clara Board of Supervisors had a meeting on April 16, where they unanimously recommended to the state not to approve RMC request. At this moment, this request is pending with California Department of Public Health. As per RMC, all these changes will be implemented on August 12. There was an impact report released by Santa Clara County Emergency Medical Services Agency, released in April 2022. Most of my observations and educational points are taken from this report. Now, as we know, RMC location is very unique. It is located in highly populated area on the East San Jose. Total population of San Jose is 1 million. RMC cover about 1/3 of the population of Santa Clara County, while other 8 hospitals, they cover remaining 2/3. So we have only 264 beds for about 600,000 lives, and while 3,000 beds for other 2/3 of the population, approximately 1.2 million. So you can see the health inequality. RMC area should have at least 1,500 beds if you go by equitable distribution, but you have only 264, making it about 17% of the resources it needs. This is the only hospital in 5-mile radius, and there's a high rate of vascular disease and trauma. Now, demographics are also very unique to regional. We have majority is Hispanic or Latino, 50 to 60%, and then Asian, 41%. Now, this slide needs some attention, and I want to make it common to all 3 programs: trauma, stroke, and heart. And this is Santa Clara County. The whole county is like this. And then you see this is RMC and highly dense population along with a lot of disease prevalence. And if we go with trauma, there are only 3 trauma centers in the whole Santa Clara County. One is RMC here, then VMC, Valley Medical Center, and we got Stanford here. So if we close this one, all this feeding area will have no coverage. They all need to travel up to here. And in case this is busy or don't have capacity, you have to go all the way there. Now, same is true for stroke and heart disease. Now, to travel from RMC to Santa Clara Valley or Good Samaritan Hospital, it will take at least anywhere between 15 to 30 minutes. And that too in ideal situation, and to Stanford can be another 20, 30 minutes. But we're talking about during peak hours, it can be very, very challenging to transfer a patient. Now, closure of this specialty program will mean that on August 12, there will be no longer any in-house trauma surgeon, neurosurgeon, OR tech, Angio Suite tech, plastic surgeon, ENT surgeon, cardiothoracic surgeon, Neuro IR Physician, STEMI cardiologist, and cardiac catheterization. So if we calculate total amount of patients we see, we have 2,450 trauma, 1,870 stroke, and 2,600 heart attacks. per year. So total volume is around 7,000. And we can understand, EMS will try their best to transfer to the nearest center, but majority of the patient coming to the regional comes through the walk-in. And these walk-in need to be stabilized and transferred to the nearest hospital, which will require a lot of time. You have to call the accepting hospital. There has to be availability of bed. Critical care EMS has to transport and condition of the patient. And it can take hours at a time. Now, I remember when RMC closed their doors to pediatrics and OBGYN, and any pregnant woman coming through our door, is such a commotion to transfer patient from RMC to any other hospital. No, here you're talking about dozens of patients, which may have to be done every day, and it will increase chances of serious harm or even death on daily basis if nothing is done in extremely underserved area. Remember, we have only 264 beds as compared to required 1,500 beds. And if you cut down these 3 critical services, this will have very major impact on the health of the population. Moreover, we need to consider RMCs already without pediatrics, OBGYN, gastroenterology, and nephrology. And medical care without these 3 additional services, which will become maybe substandard or at time unsafe. Now, transfer will affect all the 8 hospitals in the county, as well as Washington Hospital in Fremont. Now, when we talk about transfers, it will cause healthcare crisis, increased number of patients in these EDs who are sick and will utilize their resources, making overcrowding and quality of care to go down. But more important than that is the next step. If people of San Jose lose their confidence in RMC ability to provide standard and safe medical care, they may preferentially go to the neighboring hospitals for hospital level care, and it will cause truly public health tsunami. Just adding emergency beds at RMC would not help, because once you lose the confidence of the public decide where they go, not EMS or any other agency. Moreover, all these 3 vital programs, they are the health assets of the community. Now, once you lose trauma, you will have no longer be a hospital for access for disaster management. And we are talking about large-scale incidents, just like significant earthquake, a vehicle accident involving public transportation, active shooter incident in densely populated East Side San Jose. I mean, this will be a major step backwards. And as we are so thankful to Supervisor Smitian at the Board of the Supervisor meeting on April 16, and he said something which resonates to everybody. There is the legal obligation of a regulatory body to exercise its authority that exists in part to render judgment about a public harm that is about to occur that is inconsistent with the regulatory framework. In line with the Board of Supervisor request and the impact report, we request Honorable Dr. Tomas Aragon, Director of California Department of Public Health, to make the decision immediately. And the reason to make the decision immediately is, a lot of specialty staff are leaving. Physicians typically need 90-day contract. They have been given pink slips, all neurosurgeon, neuro IR, trauma surgeons. They are signing the contract somewhere else. Same thing goes to the specialty nurses as well as techs. So if you make a decision by deadline, August 11, even you say, they cannot close, RMC may not be salvageable because all the people have left. So if you have to do anything, I would strongly request, humbly request, you should do it now. Don't make RMC to bleed more. You already have a unanimous recommendation by Santa Clara County Board of Supervisors who represent people of Santa Clara County for about 7 weeks. I mean, I don't understand why we are taking that long when you know the consequences. So please do not become complacent in creating healthcare crisis or tsunami in the Bay Area. Let's work with all our force to prevent it. We really look forward to hearing from you. In the last, I will ask public, this is a team effort. We all are working as volunteers. Please sign the petition, spread it to your family and friends. Again, your wife, your sister, your brother, your cousin, grandpa, grandma, and your friends and your kids. They all can sign. Each one has one vote. And if we represent 600,000 population, let's make it a big success so people understand they care about their health assets. Thank you so much. Let's work together as a community for do no harm and health for all. Thank you very much.